Alright guys, this unit is on patient education, and this is a really important unit because at the end of every chapter we've talked about patient education and how each chapter you can affect patient education with that chapter. So this whole unit, or this whole chapter is about patient education. And this is really important because the patient is the center of our focus with their healthcare. So if they're educated and they are willing and able to help themselves out and be educated on their topics and their illnesses and diseases, it's going to make everything a lot better and your practice run more efficiently. So some of the objectives that we are going to cover with this unit is we're going to discuss the holistic model of patient education related to health and wellness. Also, we'll instruct patients according to their needs to promote health maintenance and disease prevention. We'll summarize the stages of grief and suggest therapeutic interactions for grieving patients. And we'll list at least 5 guidelines for patient education that can affect the patient's overall wellness. We'll need to be able to do the following related to patient factors that affect learning. We'll need to be able to define 6 patient factors that have an impact on learning. We'll display respect for individual diversity. We'll summarize educational approaches for patients with language barriers. We'll also need to be able to do the following related to a teaching plan. We need to determine potential barriers to patient learning, assess the patient needs, determine the teaching priorities, decide on appropriate teaching materials, develop a list of community resources related to patients' healthcare needs, and facilitate referrals to community resources in the role of the patient navigator. We'll decide the appropriate teaching methods, implement the teaching plan, and then demonstrate the ability to develop an appropriate, effective patient teaching plan. And then describe the role of medical assistants in patient education, and then finally integrate the legal and ethical elements of patient education in the ambulatory care setting. Also discuss the applications of HIPAA. And HIPAA, of course, stands for Health Insurance Portability and Accountability Act. So when we get started here under models of health and illness. Now, it's our responsibility not only to teach patients about disease processes, but also to help implement related skills and changes in lifestyle to promote recovery and improve function. So the key to successful teaching or health teaching is to empower the patient to accept responsibility of their disease process and to become willing to implement those teaching guidelines. So shorter average hospital stays means that the patient and families must provide more care. So greater responsibility is now educating those patients. So if they need to get out of the hospital, if they want to get out of the hospital, they have to be educated in how to care for themselves. So using a holistic approach addresses the patient's physical, psychological, social, and spiritual needs. So if you look at this diagram here, and this really shows a holistic approach. So you have the patient in the center. And basically the holistic model suggests that we look at the patients and determine their needs based on a complete view of their lives rather than just an analysis of their specific disease. So you need to look at their economic status and how intellectually, socioculturally, psychologically, and physically view that patient and treat him as a whole, or treat them as a whole patient. So here are some factors affecting patients' responses. So the emotional effect of the disease, their social impact on the family and their employer, their intellectual impact, their economic impact, and their social impact. Just all those portions we just talked about on that last diagram. So it is important to know how the patient will react in all of these areas because it helps you understand why a patient may not follow recommended guidelines to maintain health. So if you look on page 55 in your textbook, you're going to see a health brief model. And basically this outlines the health brief model and presents suggested methods for applying the model in patient teaching efforts in the ambulatory care setting. Now it's kind of small in here, it's kind of hard to read, but if you please do look at page 55, educate yourself about different patient education techniques so that when you are on the job and you do have to educate patients, you are up to date. So there's basically 5 stages of grief. Okay, the 5 stages of grief are another model that may be helpful to understanding the way the patients respond to health issues. Okay, the 5 stages of grief are defined by Elizabeth Kubler-Ross. She was the one that came up with it. But basically here they are. The denial and isolation. First, you're in denial. Okay, you're confronted with a disease or an illness. Okay, the first thing you'd say is this can't be happening to me. It's not me. You know, you're in denial. Okay, and you isolate yourself. You get yourself out of. You want to be alone to deal with this. And then you become angry. You get pissed off that disease is yours and that you're facing this by yourself. So you get angry and mad at those stuff. And then bargaining. You get into the phase where you're like, okay, well, maybe this is happening to me, but what can I do else? And then you get depressed. Okay, you go into a depression, and then finally, the last stage of grief is acceptance, where you've accepted your disease and you move forward with it from there. So if you look on page 55, guys, I know this is another small slide, it's hard to read, but this is the Therapeutic Interactions for Grieving Patients. So on page 55 in your book, it talks about every step or every stage of denial, and it gets into how you can help each patient get through that. So that is essential. That is super key. So really look at that and understand that. So use these therapeutic interactions for grieving patients who are in those 5 stages of grief. And then here's some guidelines for patient education. We can read these ones. These are on page 56 in your textbook. So many factors or characteristics may affect patients' ability to learn. So it's important to provide knowledge and skills to promote recovery and health, encourage patient ownership and participation in that teaching process. And with the patient's approval, include any family or significant others in the education interventions, promote a safe, appropriate use for medications and treatments, and encourage patient adaptation to healthy behaviors. And then provide information about accessing community resources. So, excuse me, patient factors that affect learning. So what with the patient can affect their learning style? Maybe it's their perception of disease versus the actual state of disease. Okay? The patient's need for information, the patient's age and developmental level, the patient's mental and emotional states, influence of multicultural and diversity factors on the patient, and then the patient's learning style. So the medical assistant needs to be aware of all these factors to develop a coaching approach that best meets the needs of each and every patient. So we'll get into each one of these now. So the perception of disease versus the actual state of the disease. So both of these responses affect the patient's willingness to learn about the disease and his or her compliance with the treatment recommendations. So perception of the disease, that's what the patient thinks they have, or what the patient thinks is going on with them versus actually what is really going on with them. That's where we're at here. So previous life experiences can influence the patient's perceptions of a diagnosis. Maybe you're diagnosed with some type of cancer and you've had a family member that had cancer. So you have a personal previous life experience that connects you with that, and that might have might alter your perception of that disease or diagnosis already. Does the patient recognize and accept the seriousness of the diagnosis? Okay, and does the patient overreact to potential disease risks? So it's important to really understand the patients and see where they're coming from there. The patient's need for information. So perception of impact of disease on his or her general health also determines the need for information about the disease. So encourage patients' ownerships in the learning process. Encourage them to participate in needing this information. So to accomplish this, you first have to persuade the patient that he or she needs to understand the disease before an improvement in their overall health and wellness can be achieved. Okay? And then we have the patient's age and developmental level. Okay? So adapt the teaching plan to meet the specific learning needs. Be flexible and creative in providing learning opportunities that support the physician's attempt to educate the patient. And often, the key to patient understanding and compliance is involvement with family members. If you have family members involved and you have another person fighting your battle with you, you're able to reach into that patient a lot more and really break through to them. Then we have the patient's mental and emotional states. So patients frequently use defense mechanisms to protect themselves. So be sensitive and adapt teaching interventions as needed. Even a well-planned teaching intervention can be ineffective if the patient is unable to pay attention because of anxiety or stress or anger or denial. So you really need to break through to that patient and use that therapeutic communication that we previously talked about and offer that support to them. The influence of multicultural and diversity factors. So culture, family background, and religious beliefs influence patients' actions. So you need to be aware and sensitive of the impact of these factors on the learning, on the patient learning. So is language an issue with your patient? Are they like an English second language or English third language even? Do the patient's culture, ethnic background, or religious beliefs influence the way he or she perceives the disease and the role of the healthcare workers? What strategies or techniques might summarize patient education problems? And then are community resources available that can facilitate patient learning? And then you have appropriate, different approaches for language barriers. So some things you can do is to address the patient by a last name, Mr. Smith or Mrs. Jones. Be courteous and formal in your communications. Always be professional. Use gestures, tone of voice, facial expressions, and eye contact, kind of like I try to do through these lectures. Use pictures, handouts, models, and other visual aids to help reinforce what you're trying to say. And then monitor the patient's body language, especially for different facial expressions. So by monitoring the patient's body language, you can look for signs of confusion or misunderstanding, and that will help you kind of break through that language barrier. Also use simple everyday words, demonstrate all procedures, implement the teaching plan in small manageable steps, and then give the patients written instructions for all procedures and treatments. So if a person has a language barrier, if there's a language barrier between you and your patient, how can you check the patient understands the procedure before the, how can you check that the patient understands your procedure demonstration? Okay, and this is very similar to how you would make them show their understanding of any type of instruction. You basically just have the patient return the demonstration to you to check for the understanding and make sure that they did it right. And then if you need, use interpreter if available and appropriate. And then the last one here was patient learning style. So individual learning styles affects your patient's understanding. Some patients learn best from discussion or lecture, like these, whereas others might think or reflect about the material before they understand it. And then some patients can learn from observing. Others must act or do something with the material in order to learn it. So ask your patient how he or she prefers to learn new material, and then pattern your teaching interventions along those lines. Now you might have some patients with vision loss, okay? So if you are working with a patient that has vision loss, alert the patient that you're in the room and identify yourself. They're unable to see you, so they rely on their sense of hearing. The patient is unable to pick up your body language. They can't see your gestures and your mannerisms. So be sure to use clear language. Okay, use clear, concise language and a normal tone of voice. And then provide all written materials in large font or print size if they are not completely blind. Do not touch the patient without warning. They cannot see you, and that might be an unwanted touch, and it's kind of shocking. It comes out of nowhere. Then you have the patients that have hearing loss. So if a patient is wearing a hearing aid, ask them whether it is on and working before you start the conversation. If the patient may turn off the hearing aid to prevent an annoying background noise as well. So allow your patient to see your mouth when you're talking to them. Make good eye contact and speak clearly. You may need to touch patient lightly to gain attention. If they're not hearing you or not responding to you, they don't see you, a light touch will let them know. And use expanded speech. Now, you might be asking, what is expanded speech? It is when you lower your tone of voice and pronounce each syllable. Okay, so it is kind of talking like this. Observe body language for understanding and confusion. Use gestures or demonstration because they can see. Clearly print any information needing clarification and provide written handouts to them. And then request family assistance to verify that the patient understood. Some more patients with language barriers here. Determine whether the patient can read or understand English. That's going to be step number 1. If possible, have an interpreter or a family member present that can help you with this. If available, use a dictionary that translates as many words as possible for the patient. Use gestures and demonstration to get the message across. Carefully observe your patient's body language to determine the level of understanding. And then order educational materials in the patient's native language. So send materials home in English if a family member can interpret the material for the patient. You really just need to reach out to every patient on an individual basis and treat them the best way that you possibly can. So in order to assess the patient's needs, you need to assess the patient as a learner. So before developing a specific approach to patient education, you must consider potential barriers to learning other than those already present, such as the presence of pain. So consider what the patient already knows about the diagnosis and if that knowledge is accurate. And then you can consider what the patient needs to know, what they want to know, and what can be done in the time available. So here are some potential barriers to patient learning. Individual learning style, everybody learns differently, so those could be potential barriers in the way. Age or developmental level, uses of defense mechanisms, the language barrier, as we've talked about a couple times, their motivation to learn. Maybe they just don't even want to be there, they don't care. That can get in the way of getting through to that patient. Their physical limitations or disabilities might be a barrier, their emotional or mental state, their cultural or ethnic background, pain, as we said before, and then of course time limitations. So we're talking about determining teaching priorities. So if you start with something the patient knows or understands, he or she will feel more competent and capable with managing new information. So confirm what the patient knows about the problem and attempt to correct any potential misconceptions. Go on to new material that is causing the patient the most anxiety. So start with something they know, and then work your way onto more complex things to help relieve that anxiety. So begin with the basic details about the disease and add more information during each patient visit. Take advantage of every teaching moment and then use the waiting room as a place for learning, providing up-to-date educational materials about the most common things in your socioeconomic area. Deciding on appropriate teaching materials. So individualized instruction is key to understanding and patient compliance. You really need to reach out to them at an individual level and educate them about their disease or their illness or whatever they're going through. So include a handout or some type of printed material that reinforces information and that the patient can use as a resource. So there are many factors that can limit the patient's ability to comprehend or remember information. Some of those patient factors could be the use of defense mechanisms, their emotional state, and language barriers can limit the patient's ability to comprehend and remember information. Guidelines for education supplies. So the ambulatory care setting where you're employed may develop its own educational materials. If that's the case, the materials should be written in lay language at a 6th or 8th grade level to promote general patient understanding. So leave out the medical jargon. Really reach out and connect with that patient at their level. Information should be well organized and clearly described. Okay, it should follow kind of an order and it should have a flow to it. All material should be checked for accuracy. If you're going to print it and publish it in your office, you want to make sure it's correct and getting the point across. Handouts should be attractive and professional. You're not just going to want to see a plain sheet of paper there. That doesn't catch the eye. It doesn't make them want to read more about the disease. Make it attractive, make it eye-appealing, and that way they're more intrigued by it and want to read more. And then copies should be available in other language when possible and in large print to get across to all those barriers that we may face. So, identifying community resources. Depending on the patient's age or across to the appropriate technology, using media resources or referring the patient to physician-approved healthcare sites on the internet can help the patient ownership of the learning process and provide excellent resources for patient referral. So you have to assist patients and families in finding and using community education and support services. All right, so maybe they need to find some sort of counselor, or they need to go to a tobacco cessation clinic. You guys need to be able to work with them and really help them out any way that you can. So you need to be able to develop a list of community resources. When you start a new job, whether it's in your hometown or another city that you guys go to, really start to look into what that community has to offer. Is there a Hope and Justice project? Is there like a Meals on Wheels type of thing where you can really help get patients meals if need be, or a Salvation Army? Know what's in your community so you can give your patients the best and most optimal care. And then of course keep these up to date in a file of area resources so that you can assist any patient that comes along. So we've talked about this before, the medical assistant as a patient navigator, and this is really key. So a patient navigator is a person who helps patients and families with insurance problems, explains treatments and care, communicates with the healthcare team, assists caregivers, and manages medical paperwork. So medical assistants are cross-trained in administrative and clinical skills. We are administrative medical assistants. So we only get half of this. So they are a unique position to serve as patient navigator in ambulatory care settings. We still can assist in a lot of those. We can assist in, the insurance problems, explaining patient education materials, communicating with the healthcare team, and then of course all the medical paperwork. So if you look on, on procedure 5-1, which is on page 60 and 61 in your textbooks, that will help you be able to develop holistic community resources for patients' healthcare needs and facility referrals on in the role of patient navigator. So that's really key. Here we go. Deciding on the appropriate teaching methods. So we've talked about developing different teaching methods and looking at the learning styles and everything like that, but now we need to decide on appropriate teaching methods. So use community resources to reinforce your message and teach patients specific skills. So using the exact piece of equipment that the patient will be using at home by first demonstrating to the patient how to perform the skill, and then ask the questions and explain further as needed, and then have the patient return the demonstration before leaving the office. That way that you know that they know how to do it and what needs to happen. Have the patient keep a journal of his or her activities and responses to treatments. And then, of course, involve family members in patient education. But like I said, the more people you have fighting the battle, the better off you will be. So once you've decided on your a teaching method, you need to implement that teaching method. So conduct these lessons and implementation in a quiet area away from distractions. Assemble all equipment the patient will need and present only material or skill it is possible for the patient to master before the end of the appointment. It's important to restate, repeat, or rephrase the material if needed, and then, of course, evaluate the teaching plan throughout the process. Another crucial aspect of successful patient teaching is consistently asking for feedback on the process. How are things going? Do you enjoy this? Okay, those types of questions. Plans should be made for educational intervention during the patient's next visit, and then document details about the material covered, the patient competency or level of skill in learning treatment techniques, and any referrals made for community or hospital experts or educational groups. Okay? So your role as a medical assistant as the patient educator. Okay? So if you look on page 63 in your book, which is procedure 5-2, this basically helps you coach patients in health maintenance, disease prevention, and following the treatment plan. And basically that's what we need to do as medical assistants. So reinforce physicians' instructions and information. Encourage patients to take action in the role in their health. Use each patient interaction as an opportunity to be able to teach health. And keep information relevant to the patient's needs. Establish and maintain rapport with the patient. Communicate clearly, be sensitive to the patient's learning factors, and then modify the teaching plan as needed to best meet the patient's needs. Everything we do is on an individual basis. So you need to take the opportunity to help reinforce their learning whenever possible. So legal and ethical issues that come up with patient education. All patients have the right to information before they agree to receive care. That is called informed consent. So conduct adequate patient education follow-up, document each patient education intervention completely and accurately, and then meet all the needs of patients without evidence of prejudice. Okay? Another consideration arising from the Patient Bill of Rights is the issue of patient confidentiality as it relates to patient education. It's important to always maintain that patient confidentiality. All right? And us as medical administrative assistants, we need to make sure that we stay within our scope of practice for our states, and we never offer medical advice. We are administrative assistants in the medical field. We are not medical specialists, okay? And then finally, how this all applies. So at the first office visit, the patient should complete a release of information form that identifies, if the patient agrees, a particular family member, maybe a close friend, or any other individual that the patient states can receive disclosures of their health information. So the patient has the right to restrict who can receive that personal health information, or also known as PHI, which we'll refer to it as constantly throughout this text. Only the person or persons identified on that HIPAA release consent form completed by the patient have the right to the patient's personal information. Nobody else has that right. So contact the family only if the patient has given approval. So in all, guys, that ends our lecture for the day. If you have any questions, feel free to ask me. Keep working hard, keep doing great, and have fun on the assignment.